Welcome back. Stroke is one of the leading causes of death and adult disability in our country. So how do we stack up here in Tucson? Well, Dr. Alexander Coon from Carondelet Health Network is here with the details. It's such a pleasure to have you.
Thanks for having me, Alex.
Such an important topic because people, I don't think, realize the full scope of this or really what it means to have a stroke. So we're going to kind of break it down for people. But let's talk first how we stack up here in Tucson as compared to the rest of the country in terms of cost, in terms of incidences, et cetera.
Well, thanks for having me on here to talk about this very important subject. Stroke is something you can't avoid. It's number one. Risk factor for stroke is quite simply age, and it's something that all of us do, and the population continues to get older. And here in Tucson, as you know, we have a significant population of people that are older age. So it's something that's common. Between 800,000 and 1 million strokes happen in the United States of America. That makes it, as you said, one of the leading causes of death. And it's certainly far and away the leading cause of permanent disability for our citizens. And here in Tucson, we experience a lot of it too.
And it's misunderstood, right? I don't think people fully grasp what happens during a stroke. So break it down a little bit for us.
That's correct. So stroke can mean a lot of different things, but it generally means disruption of blood flow to the brain, which causes the neurons, the working parts of the brain, to either die or have malfunction from them. And this manifests itself in some very classic symptoms that can be seen and end up causing disabling. Stroke can be from blocking of an artery. Stroke can be from bleeding into the brain where arteries of the brain don't get blood flow. Those are the two main classes.
Got it. And I know we have some images too that sort of demonstrate a couple different types of stroke. Tell us what we're seeing here on the screen for people to know.
What we're seeing on this picture is a picture of a cerebral vessel or artery. And what you see is a chunk or clot sitting in that artery. And when that artery that leads to the brain is blocked, the brain is being starved of oxygen-carrying blood. And it doesn't take long for neurons to start dying. We typically use the expression that, every minute that the brain is starved of blood, millions of neurons die. So it makes it an immediate medical emergency.
And as far as symptoms of what we can expect, something that can mimic a stroke too, talk about what people might experience.
Well, the classic symptoms of stroke, we use a mnemonic called FAST, F-A-S-T, face, arm, speech, and time. And typically these are symptoms that start acutely, abruptly. Okay? They can affect your face with facial drooping. It can affect just your arm, and it can affect your speech. And typically I tell patients, you'll know you're having a stroke oftentimes when it affects one side of your body. Someone who says, both my hands feel weak, or both my legs feel weak, or I generally feel weak, you're not having a stroke. Stroke typically affects that one side of your body, affects your ability to articulate language or speak or understand words, and oftentimes it manifests in the face as well.
Yeah, and if there's one message I think that we want to hit home for people is that you can do something about it in the moment if you take care of it quickly enough, right? So you're encouraging people, don't wait.
Yeah, that's right. And
take care of it.
Diagnosing a stroke in 2019 is so important because in 2019 there are tremendous options for treatment of stroke, not just to prevent it. We want to prevent stroke. And if you have a stroke, we want to rehabilitate you and get you back the best we can. But when you're having a stroke, there are treatments, surgical treatments, that can be done to abort and sometimes even miraculously reverse the symptoms of a stroke. And that means you have to get to the hospital. You have to get to someone, to a team of physicians that can identify this and diagnose this and make the determination of what to do. It's not on you to decide whether or not you're having a stroke. It's just something where if you think there's a possibility of you're having a stroke, get to the hospital and let us decide for you because, like I said, time is brain, and you don't want to miss out on that opportunity.
That's right, and the treatment options just continue to grow. I mean, as we mentioned, this wasn't around, a little while ago even. Let's talk about the different treatment options.
Stroke was untreatable until, 15 years ago where clot-busting medications came around. But in the last 5 years, there's been a revolution in stroke, an earth-shattering revolution where we now have the ability to access the arteries of the body through the arteries of the groin and gain access to the arteries of the brain and go in and take that clot out, to remove that clot in real time in a matter of sometimes just minutes. And when you can do it safely and effectively like that, it allows us to treat people who before would be devastated and even pass away. And it all starts with knowing you have to come in when you're having these symptoms. You have to let let the physicians decide whether you're having a stroke or not. We're happy to do it.
That's right. Such important information. People really have to become educated is the truth about this, because biggest risk factors, you said, is age, and we're all getting there. So
yeah, we all are. Some of us quicker than others.
Time, yeah.
But
that's
for certain, it's something that you can't avoid. And even those people drinking carrot juice in California have stroke. It's one of those things where age is something that catches up to all of us.
There it is, Doctor. Very important. Thank you for being here.
My pleasure.
Nice
Thank
to meet you. And if you'd like to learn more about the Carondelet Neurological Institute at St. Joseph's Hospital, visit carondelet.org or call 833-915-1577.